The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Hello, everyone on the call. It's a pleasure to be here. As mentioned before, I'm a patient educator. My name is Bob Thomas. I'm one of 5 patient educators, actually, for Coloplast. And what you might ask yourself, what the heck is a patient educator? Well, a patient educator is someone who's been through not only the experience of a surgery and a penile implant, in my case, but also a patient who's been through all of the various stages that were referenced in the doctor's presentation here tonight, including going from pills to injections to ultimately a penile implant. And so there's a whole story in and of itself around that. Patient educators are not medical people. We're not people that are going to give you medical advice, but we are people that can be a resource for you if you're thinking about an implant, if you've had an implant and have questions about comparing your experience prior to surgery and after surgery with mine or one of the other patient educators, or if you just want to hear any perspective from a patient standpoint regarding this whole process and penile implants. Again, we're not doctors, so we can't dispense medical advice, and we certainly will not do anything to try to sell you on any decision one way or the other. We're here basically as a resource to answer questions. And I would say I talk to an average of about half a dozen patients a week. Most of them are facing into the decision and have made the decision or planning to make the decision around having an implant. Many of them, however, are people that have had the surgery and say, hey, I got this now and I want to compare notes with you. So either way, we're certainly available for that. My contact number and my email are there. If anybody wants to talk to me about anything relative to a decision you're trying to make, please don't hesitate to text me and we can set up a time and go forward. I'll be in the 5 to 7 minutes I have here, I'll try to be relatively brief, but also try to cover some of the bases that we covered before from a personal perspective. So talk a little bit about how I came to have ED, what my treatment options were, my reasons for going to a penile implant, what my surgery and recovery was like, and how I feel about it now, 2.5 years later. So I joke to my wife that I might be in my early 70s, but my penis is only 2.5 years old. So we got to share that with you. As mentioned, I had prostate cancer, and I caught it early stage, so I basically had all of the options available to me. The field was wide open, and I wound up opting for radiation treatments, a series of 28 of them. And I did that because I was really trying very hard even then to avoid ED as a result. And I thought radiation might be my best option. And you know what? For a while it was. Actually, for the first year or so after my radiation treatment, I thought I dodged the bullet. But then eventually ED set in and it became increasingly significant. And I did the usual track that perhaps many of you are on this call, and that's I started with Cialis or Viagra. I went with Cialis daily dose at first because that seemed like the least hassle. I didn't have to worry about when I would take it. And for a while those worked, but even when they worked, there was always anxiety about when they wouldn't work. So, and there was certainly the fear that I don't want to start something I can't finish. And so that was always in the back of my mind when I used them. And eventually they, as I said, worked until they didn't work. I progressed from there to Trimix. And the Trimix worked really, really well. And I was happy with it up until the time that I probably overdosed myself and wound up in the emergency room with the infamous erection lasting more than 4 hours. And while I was there, a doctor, one of the emergency room doctors, said, "You ought to look at penile implants." And I had no idea what they were at the time. And so my first reaction was, no, I don't think so. I guess I had this mental perspective of an erector set or something like that. But once I started looking into them, I realized that, hey, this could be the solution. First of all, it takes away all of the need for pre-prep. Whether it's pills, you have to remember to take them. Whether it's shots, you have to. And I travel a lot on business. You have to remember to take it with you, and you have to keep it refrigerated. All the things that the doctor mentioned. And so I looked at the penile implants, and they look like they had a very high satisfaction rate. All of the literature I read indicated that the satisfaction rate was as high as 98% for patients, and just as importantly, or perhaps even more importantly, that satisfaction rate was just about as high for their partners, which of course is very important and one of the reasons why we're all doing this. And so, again, I did a lot of research, but it was really what did it for me in terms of tilting me in the direction of a penile implant was some words that were mentioned in the previous presentation. One, spontaneity. I didn't have to worry about when or how I could achieve an erection or for how long. And convenience. Again, nothing to carry with you or worry about taking at the right time or anything like that. And so after a great deal of deliberation and also a couple of consultations, not only with my prosthetic surgeon, but also a patient educator, someone like me, I ultimately decided to have the implant done. I think my surgical experience was probably very typical. They all vary somewhat, but I think my trajectory was pretty typical. I had the surgery as an outpatient. You had in the hospital and out the same day. And for 2 weeks, I went home and basically just iced. And I'd recommend for anybody who has the surgery, frozen peas are the best thing to use when you're icing. They're malleable and work extremely well. But icing was very important, and I took occasional Tylenol. But even though they sent me home with some stronger pain meds, in my case, I never needed them. I would take the occasional Tylenol if something got a little painful in the first couple of weeks, but there was nothing that I would call a deal breaker in terms of pain. At 2 weeks, I went in for my first post-op exam. Basically, that was just to check out and make sure that everything was looking good, and all the vital signs were looking good. At that point, no sign of infection or any of those risks. So at 4 weeks, I came back for my second post-op, and that's when they started show me how to cycle it. Cycling is basically making yourself erect for at least 20 to 25 minutes a day, and then deflating yourself. And it performs two purposes, one of which was you learn to use the device, which isn't very hard. I found that to be pretty easy to learn. And I'm not a doctor here, so the doctor might correct me, but I think it's also important to start stretching the tissue, and we're exercising the tissue. That's healing at that point. Anyway, they said cycling was really, really important. And so I was really, really diligent and did that every day. In fact, and continued to do that, I'd say for about 4 months after surgery. At 6 weeks, I went back for my follow-up appointment. And actually, it was my last appointment because they said, unless something happens, you really don't you don't need to come back. And by the way, you're good to go. You can resume sexual activity and whatever you want at this point. And which I did, and we did. And I'm not sure how long the residual effects of the surgery, the occasional pain after sex, or the things like that, just little soreness. I'm not sure how long that lasted, but I think for the most part that was all behind me within 3 or 4 months. But the important thing is I was back to and my wife and I were back onto a normal sex life 6 weeks after the surgery. So as I say, I talked to a lot of patients who've had this surgery, and I think that tracks pretty well with the majority of the cases. There are outliers, and but in my case, in terms of who I've been exposed to, not very many. The final thing I'd leave you with is when I'm asked, would you do it again? My answer for me personally is not would I do it again. I wish I'd done it much, much sooner. When I think about all the time I fooled around with pills and the other remedies when this was available, I really think, boy, I could have done it sooner and had a more rewarding life. And I started to say sex life, but sex is an important part of life, but it's not all of life. And I can't say enough how much this did for me, not only physically, but also did for me mentally and emotionally. I believe that was referenced earlier too, but it's a very important point to make. So that's my story. I hope I didn't go too fast. Hope I covered most of the main bases. And if you have any questions for me afterward, happy to answer them.
But first, we would like to thank our sponsors tonight, Coloplast. Coloplast is the maker of the Titan series as well as the Genesis series of the implantable penile prosthesis models we looked at tonight that both Dr. Amend and Bob spoke on. So thank you very much to Coloplast for making this event possible. If you'd like to learn more, you do have a few options. There are more ED resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you'd like to learn more about the implant options we spoke about tonight available through Coloplast, you can get answers to common questions like insurance coverage by visiting coloplastmenshealth.com. Exclusive to MenMD members, you can also book an appointment with a treatment specialist by logging in and creating an account on the MenMD new portal. You can also call in at 857-233-5837. That'll be your best bet to get any follow-up questions answered.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.